Well, thank you all for having me. I'm so thrilled to be able to do this while I'm out here for a couple of other reasons. So I am the Director of Behavioral Medicine at Mellon Center for MS down in Cleveland, Ohio at the Cleveland Clinic. I direct the behavioral medicine part of the Mellon Center. I direct the research and the training also for the behavioral medicine individuals in my center. And so I'm so pleased to be able to speak with you guys today. I hear that this is a pretty lively group, and so I'm expecting that there will be participation and questions, which I'm excited to hear about. So what I would like to talk with you today is something that is very near and dear to my heart, and that is chronic disease. As I had said earlier, I specialize in multiple sclerosis, so some of the slides will be tailored towards the multiple sclerosis population. And then the other section is going to be tailored to the caregiver, which is something that I'm very passionate about in terms of treating the caregiver as well as the patient. And as I was saying earlier, I have some kind of something in my throat, so I apologize if I cough or if it sounds like I have a frog in my throat. So just bear with me, okay? So can I just get a idea of who's in the room? How many are caregivers in the room? Okay. Okay. And how many are those with chronic neurological conditions? Okay. Does anybody have MS in here? No. Okay. Okay. Multiple sclerosis is MS. So my goal for you guys, so I made this broad and did a chronic disease, but like I said earlier, there will be some specific slides geared towards multiple sclerosis because that's my specialty, and I think we can bridge it nicely to the chronic disease management. My goal today is to talk to you about chronic disease, also to talk to you about the emotional symptoms that may accompany chronic disease, and to talk with you about things that I think that you should pay attention to if you're a caregiver or if you're somebody with a chronic disease, and teach you some ways to manage those emotional symptoms. So I'd love for you guys to shout out to me. This is a person who has chronic illness. I want you to define this person for me, and if any of the remote sites are there, I'd love for your participation as well. So when you think of somebody who has a chronic disease, what type of adjectives come to mind? How would you define this person? Angry. Okay. Okay. Thank you. Thank you for starting it. How else? Fearful. Fearful. Okay. Frustrated. Sad. Sad. Yeah. So what I'm finding is that you're talking about all of these invisible symptoms. And what I work with are the invisible symptoms. So people don't come to me and ask me to fix their knee or to give them medication for something. We work with the invisible symptoms such as depression, fatigue, anxiety, disrupted sleep and insomnia, pain, and cognitive symptoms. So I'm sure that many of you can relate to at least 2 or 3 of these symptoms, right? And it sounds like the room is very, very engaged in understanding the fact that there are the depressive, the anger, the emotional symptoms that accompany a chronic illness, correct? So I love this saying. This says, courage doesn't always roar. Sometimes courage is that quiet voice at the end of the day saying, I will try again tomorrow. And I think that that's a very profound statement for people who deal with chronic illness, because you are the most courageous of all people, because every day you get up and you don't know if you're going to be in a battle, right? So let me share with you one of my patients. So I changed her name a little bit, but I'm going to call her Nina, and she's a 34-year-old stay-at-home mom. Her husband is a physician in Pittsburgh, Pennsylvania. She has 2 young daughters and is very involved in their school, their junior league, her home's welcoming committee. She's just a very involved individual. Her father passed away when she was 26 years old, and she was his primary caregiver. She was married at the age of 28 and was diagnosed with MS that same year. In 2010, her father-in-law, a prominent surgeon in the Cleveland area, fell ill. Her father-in-law is divorced. Her husband assures his father that Nina will care for him, and as such, Nina does, meaning that the father-in-law now moved to Pittsburgh. So at this point, Nina is caring for her children, her husband, and now her father-in-law. And remember, she has her own chronic illness. So when she comes to see me, she describes some of these symptoms that we were talking about in terms of invisible symptoms, pain. She describes fatigue. She describes incredibly high expectations of herself, significant anxiety and feelings of frustration and inadequacy. She describes physiological symptoms of anxiety, such as racing heart, ruminating negative thoughts, and feelings of hopelessness. And she frequently overuses anti-anxiety medications and wine. So let's look at what chronic disease is. Well, if you look at the definition of chronic disease, we know that it's illness that persists greater than 3 months in duration. Chronic diseases are amongst the most common and costly conditions in the United States. They're very uncertain, and so where I was hearing some of you describe people who have a chronic illness, you said frustrated, irritable, and those symptoms come from probably the uncertainty and not knowing what you're going to deal with. These are just some examples of chronic illness, but Alzheimer's, dementia, multiple sclerosis is another example, epilepsy, diabetes, COPD, and CVD are all examples of chronic illness. So I thought that these statistics were important to bring to you. That the prevalence of chronic illness, 50% of the population has at least one chronic illness, 50%. So that's 1 in 2 people, right? That between the ages of 18 and 44, 30% have some sort of chronic illness. So between 18 and 44, I want you to hear that, 30% of them, so that's 1 in 3, right, have some sort of chronic illness. So another quote that I love is, "Never be ashamed of a scar. It simply means you were stronger than whatever tried to hurt you." And I just love this quote. As somebody who's struggled myself with some chronic illnesses and has quite a few scars, I think about this all the time when I look at that, because to me it just means I'm strong and I can get through this. So we look at some of the dynamic challenges of chronic illness. When I'm working with a patient or a family member, I look at changes in roles and identity. And what that means is that oftentimes there's role reversal. So oftentimes I'll see a stay-at-home person having to go back to work and now taking over the finances because the person who was working can no longer do it. I sometimes see children becoming adults way too early because they have to help. You see spouses and partners mixing up their roles. There's all of this role reversal that we have to identify and work with. As you guys had said so eloquently before, I see feelings of loss of hopes, dreams, and goals for the future. So with that comes grief and depression, anxiety, worry, and anger, denial, numbness, and hopelessness. And those are just a few to talk about. So we have our lion again. And he says, "Out of suffering have emerged the strongest of souls. The most massive characters are seared with scars." So as we're going through this, what I want to teach you is how to listen for symptoms of burnout or of depression from your partner, okay? And so some of the key components of this would be feeling like they have little or no control over life. And remember when I say this, this is not only for the patient. I want you to keep in mind caregivers as well, because caregivers are on this journey with you, right? You feel like there's a lack of reward or recognition for what you do. You feel that there are unclear or overly demanding expectations on you, either as the patient. So I had a patient yesterday who has severe limitations in terms of his functioning, and he feels like his family is being unrealistic in terms of what he can do. So again, these are things that I want you to listen for. If you hear somebody saying, "Every day is a bad day. I don't feel happy or sad. I just kind of am." So that's that lack of joy in your life anymore. You stop caring about work or your home. It seems like it's a total waste of time. You may hear somebody say, "I feel exhausted all of the time. No matter how much I sleep, I'm exhausted. The majority of my day is spent on tasks that are either mind-numbingly dull or overwhelming, and nothing I do makes a difference or is appreciated." They may feel expected to be too many things to too many people. You may find that somebody may take on too many responsibilities without enough help from others or without enough time for relaxation and socializing or that self-care that's so important. And we look specifically for changes in sleep patterns, eating, and exercise. Lack of close supportive relationships is another that we look at. So the person with the chronic illness or the person who's caring for the person with the chronic illness all of a sudden withdraws from all of the people in their lives that are important. So you may find that you or your significant other no longer talks about problems with your spouse or your partner anymore. You don't care what you eat, either too much or too little. You don't remember the last time you had a long conversation with a trusted friend. Your family stopped counting on you to be at their events. You no longer attend your place of worship or find time for quiet contemplation or meditation. You've found that you have changes in exercise habits and you don't smile or laugh as much as you used to. So some physical symptoms would include frequent headaches and backaches or pain, routinely taking over-the-counter antacids, painkillers, illicit substances, or alcohol. As you remember, my patient that I was sharing with you, Nina, does this quite frequently. Feels that nothing you do seems to matter anymore. No one can understand your needs. You feel numb or react inappropriately to situations with strong emotions. So, for example, I have a patient who can no longer cry when she attends somebody's funeral that's close to her. She's just numb. She feels too overwhelmed to seek new experiences, ideas, or ways of doing things, and frequently thinks about how to escape a current situation. So as I shared with you earlier, my expertise is in MS. And so the next couple of slides are going to be about MS specifically. There's only a couple of slides, but I feel like it can relate to most chronic diseases. So if you look at individuals with MS, or we'll replace MS with chronic disease, they will experience a range of emotions over the course of the disease. So if you think back to when you were diagnosed with your chronic disease or your family member was diagnosed with your chronic disease, you may have gone through what we call a cycle. So you may have gone through shock, you may have gone through disappointment, you may have bargained with God or with somebody else to take this away from you. You would go through a cycle until you eventually get to, acceptance or adaptation. So when I work with partners, I think it's very important to work with the patient and the partner, as I was sharing with you earlier, because I feel like each family member looks at the disease differently. It means something different to each person, right? And so no two family members are going to react to the disease in the same way. The emotions are going to be related to many different things. So stresses and challenges created by a chronic, unpredictable disease certainly causes some form of emotion. The symptoms of the disease itself. So some of the symptoms hurt. Some of them are functionally impairing. Some of them are causing mood disorders. And then certainly family and friends' reactions. So here's kind of the cycle that I was referring to earlier. So initially when you have received a new diagnosis, you may initially start to have symptoms and you may deny them, right? You may say to yourself, well, I'm not having that memory loss. It's just, it's just because I'm 60 years old. It's really nothing big. I'm just going to forget about it, and it's probably going to go away, and once my stress level decreases, I'll feel a lot better, right? The problem with denial is that it can get in the way of early treatment decisions and self-care strategies. And so it's very important to, when you feel like you're having a symptom over and over and over again, to get it addressed. Another feeling or stage that people may explain to me is shock. So this can't possibly be happening to me. Remember the statistic I gave you about 18 to 44-year-olds, 30% of them have some form of chronic illness. So when you look at that population, there's extreme shock. They're in the midst of their childbearing years. They're just getting married. Their careers are taking off. And all of a sudden, bam, a chronic disease has hit them. And so they're thinking that they're very healthy, and then all of a sudden their life has changed. Fear. So my life is going to be ruined. I treat an OBGYN surgeon, and I just saw her yesterday, and she is stuck in fear. Every time she has a symptom, she is so fearful that she's never going to be able to operate before, and so operate again. And so what happens to her is she'll have a symptom that may be residual in the MS disease, and she'll assume that her MS is getting so bad that she's not going to be able to operate again. And she goes into this catastrophic thinking, this downward spiral, and then all of a sudden she's saying, I'm not going to be able to care for my children aren't going to have a mother, and it goes into this really awful place. And so we have to stop those thoughts as they come on initially. Anger, I heard somebody say this earlier, I have the worst doctor, why can't they just find out what's wrong with me? Going from doctor to doctor to doctor, right? And trying to figure out, why has this person diagnosed me with this? This can't possibly be what I have. Or why would such a loving God give this to me? I hear this very frequently in my practice. A lot of guilt. So my surgeon that I was referring to earlier frequently says to me, I'm going to let my entire family down because I'm not going to be able to work anymore. My hand is shaking too much for me to make a cut appropriately, and I'm no longer going to be able to work anymore. I'm not going to be able to take care of my children. My children aren't going to be able to stay in their school system. And again, this negative cycle continues. And then sometimes you find relief. So, well, at least it's not cancer, or at least it's not a stroke. This is what some of my patients will say to me. I finally understand why I've been so tired. So sometimes when people have MS or a chronic disease, it is so disabling and it's so tiring that they now have a reason. And so to them, it's kind of relief for having a definition in terms of why they are so tired. Or finally, I know what's happening to me, and that's relief as well. We have longer-term reactions such as grief, and this is a unique type of sadness that is a normal reaction to change or loss, anxiety, anger, and guilt again. And eventually, we work to move towards adaptation. So we help to teach patients that even though life will change, patients can learn to adapt and still have a good life. We recognize that there are identity changes. As we had talked about earlier, the role reversal is real, but new identities can emerge. And I think it's so powerful to work with somebody who was so passionate about their work and they had to give up their work, but they found something else that is able to take over their passion, and they have meaning again. And it's such a pleasure for me to be a part of that journey with people. I always like to share with people that the emotions that you have are real and they're normal. But I think that it's very important to only let yourselves be stuck in those negative emotions for a short period of time before you need to move on. And we can help you, psychologists can help you do that. So let's move on. So I want to look at specifically the impact on the family or the caregiver. So who is a caregiver? So this is a person who helps with physical and psychological care for a person in need. Oftentimes it's a family member, but not always. They're often unpaid. 66% of family caregivers are women. 65% of care recipients are women. And these individuals typically work not less than 20 hours per week in their caregiving role. So that's a part-time job, right? And that says not less, so sometimes they're working a lot more than that. When we look at caregiving burden, we look at a multidimensional response to physical, psychological, emotional, social, and financial stressors associated with the caregiving experience. So let's look at a model of caregiving, and this is the best one that I felt that I could explain to you. So there are 3 different stages of caregiving in this model. First is the encounter phase, and this is where you confront the diagnosis, you grieve the loss of your previous life. You can no longer go on those 45-minute hikes anymore, for example. And in this stage, you're acquiring skills necessary to care for yourself and your family. The second phase is the enduring phase, and this is where you're really submersed into the caregiving role. You also learn everything that there is to learn about this disease. Your neurologist will explain it to you. You've done research on it, whatever association you belong to. At this point, we oftentimes see that the caregiver's health starts to decline. And the third phase is the exit phase. So you either adapt completely to the new role that you're in, there's a death, or there's care outside of the home. If we look at the caregiving reality, what we know is that it can be profoundly fulfilling. So many people will say it's brought us so close because we are spending all of this time together and it's meaningful time and I love taking care of my spouse. But it can also be very challenging. And what I'd like to do is focus on 3 areas where it can be particularly challenging. So number 1 is financial challenges. So if we look at the bottom line financially, 58% of all caregivers are employed. The median incomes are 15% lower than non-caregiving families. Caregiver is 2.5 times as likely to live in poverty. I think that's a staggering statistic. And the out-of-pocket expenses are $5,500 a year, which can be 10% of the median family income. That's a lot of money that's going into this role. Let's look specifically at the physical burden here. So what we see from the caregiver, remember I was telling you about stage 2, you start to see the caregiver's health declining. And I think that this is very important to point out that in this role, we see caregivers having increased stress, which can lead to high blood pressure, high blood glucose, or your sugars are high, a weakened immune system. 72% report that they don't take care of themselves. They only focus on taking care of their spouse or their partner. We see pain. We see poor eating habits and change in eating habits, difficulty with sleep, fatigue, lack of exercise, changes in sexual functioning, premature aging, and it may decrease the life expectancy by 10 years. That's more than smoking will do, right? So what I like to focus on specifically is the emotional health. And so I find that the caregiver oftentimes has decreases in well-being and psychological health and increases in depression, anxiety, and stress. They feel that there's a sense of failure and self-doubt within them. They sometimes feel helpless, trapped, and defeated. There's a detachment from the world and from other important people around them. So as I was saying earlier, there's a tendency to withdraw if you're either the patient or the caregiver, if you've been put into this new role. There's a loss of motivation. They're increasingly cynical and they have a negative outlook on life, decreases in satisfaction and sense of accomplishment. In terms of behavioral symptoms, so these are things that people do, they withdraw from responsibilities, they isolate, they procrastinate, they use food, drugs, or alcohol to cope. They take their frustrations out on others, so you may see somebody have a real short fuse, or they're very irritable, or I oftentimes hear the term walking on eggshells. They skip work, or they come in late, or they leave early. How am I doing on time? Do I have time to show this clip? I'm good? Okay. Okay, great. All right, so one of my favorite researchers is named Robert Sapolsky, and he's out of Stanford. Robert Sapolsky studies the effect of stress on the human body, but he doesn't only study the effect of stress on the human body, he gets his information from studying in the desert, and so he studies the effect of stress on animals as well. So I'd like to show you a clip of, if I can get to it here. This is a really cool clip, and let's see. There we go. Do I have 5 minutes to show it? Okay.
This program is brought to you by Stanford University. Please visit us at stanford.edu.
If you're a normal mammal, what stress is about is 3 minutes of screaming terror on the savannah, after which it's either over with, you're over with.
Over the last 3 decades, Stanford University neurobiologist Robert Sapolsky has been advancing our understanding of stress, how it impacts our bodies, and how our social standing can make us more or less susceptible.
Is the aggregate values.
Most of the time, you can find him teaching and researching in the high-achieving, high-stress world of brain science.
There is this huge contrast
But that's only part of his story. For a few weeks every year or so, Sapolsky shifts his lab to a place more than 9,000 miles away on the plains of the Masai Mara Reserve in Kenya, East Africa.
You live in a place like this, you're a baboon, and you only have to spend about 3 hours a day getting your calories. And if you only have to work 3 hours a day, you've got 9 hours of free time every day to devote to making somebody else just miserable.
Yeah.
They're not being stressed by lions chasing them all the time. They're being stressed by each other. They're being stressed by social and psychological tumult invented by their own species. They're a perfect model for westernized stress-related disease. Because what stress is about is somebody is very intent on eating you, or you are very intent on eating somebody, and there's an immediate crisis going on.
When you run for your life, basics are all that matter. Lungs work overtime to pump mammoth quantities of oxygen into the bloodstream. The heart races to pump that oxygen throughout the body, so muscles respond instantly.
You need your blood pressure up to deliver that energy. You need to turn off anything that's not essential. Growth, reproduction, you know, you're running for your life. This is no time to ovulate, tissue repair, all that sort of thing. Do it later if there is a later.
When the zebra escapes, its stress response shuts down. But human beings can't seem to find their off switch.
We turn on the exact same stress response for purely psychological states, thinking about the ozone layer, the taxes coming up, mortality, 30-year mortgages. We turn on the same stress response, and the key difference there is we're not doing it for a real physiological reason, and we're doing it non-stop. After a while, the stress response is more damaging than the stressor itself, because the stressor is some psychological nonsense that you're falling for. No zebra on Earth running for its life would understand why fear of speaking in public would cause you to secrete the same hormones that it's doing at that point to save its life. I'm studying stress for 30 years now, and I even tell people how they should live differently. So presumably I should have incorporated all of this, and the reality is, like, I'm unbelievably stressed and type A and poorly coping, and like, why else would I study this stuff 80 hours a week? No doubt everything I advise is going to lose all its credibility if I keel over dead from a heart attack in my early 50s. Nah, I'm not good at dealing with stress. You know, one thing that works to my advantage is I love my work and I love every aspect of it, so that's good. But nonetheless, this is pretty clearly a different place than the savannah in East Africa. You know, you can do science here that's very different and more interesting in some ways. You can have hot showers on a more regular basis. It's a more interesting, varied world in lots of ways, but you know, there's a lot out there that you sure miss.
So I wanted to share that with you because this is what I am so passionate about, and that is teaching people how to manage their own stress so that your own bodies don't start absorbing stress as he was describing in this. And so you have the link on your slides, and you can share that with anybody that you'd like. But I'd also like to point out that his book is called Why Zebras Don't Get Ulcers. And I know Dr. Hirsch has heard me talk about this way too many times, but this is also just a terrific book which talks to you about the importance of managing your stress so that your body doesn't start to show the effects of stress. So let's talk about that. So I'm going to teach you some skills today in terms of how do we manage our own stress. Well, the first thing that I'd like to share with you is something that was shared with me this morning when I got on a flight, and I heard the flight attendant say over the loudspeaker, in the event of an emergency, if there is loss of cabin pressure and the oxygen masks fall, you need to put your oxygen mask on first before helping the person next to you, right? And so that is just, I think, something important for all of us to remember in life, which is if you don't take care of yourself, you can't possibly take care of anybody else. You can't possibly help somebody else if you're sick yourself. So what are some of the personal barriers to self-care? Well, I want to explain to you how to remove some of those barriers. And so by doing that, I talk to my patients about, I ask them questions such as, do you think you're being selfish if you put your needs first? Is it frightening to think of your own needs? What is your fear about? Do you have trouble asking for what you need, or do you feel inadequate if you ask for help, and why? So misconceptions that may interfere with self-care include, I am responsible for my parent, spouse, child's health. If I don't do it, no one else will do it. If I do it right, I will get the love and attention and respect that I deserve. And this is what I wrote a book chapter on caregiving, and this is kind of the way that I like to conceptualize what I call the trifecta of the patient and caregiver self-care. So if you see, we're going to talk about emotional support, wellness activities, and caregiving essentials. So first, of course, we've spent a lot of time talking today about emotional support. Excuse me. And so what I like to do with my patients is help them to identify dysfunctional coping skills and mental health needs. Most of the time, you probably work in a multidisciplinary team where any number of the providers can help identify needs. They can help to refer you to a provider with an experience in chronic disease management, and I like to say this to everybody, that early recognition is linked with more successful outcomes. 2 is caregiving essentials. So many patients and caregivers come in with no past experience in chronic illness or caregiving. Unless you're in the medical field, and even sometimes if you're in the medical field, you still don't have experience caregiving for a chronic illness. It's important that we are able to provide you with referrals to national organizations for both the patient and the caregiving spouse. So for example, National Family Caregivers Association is a phenomenal association. The American Psychological Association, and then I'm sure any chronic disease has their own association. And so it's important to brainstorm with others ways to ease the burden. 3 is finding wellness activities. So identifying individual barriers to self-care, utilizing stress management techniques, attending to your own health needs, exercising regularly, developing activities outside of the caregiving role, utilizing or building strong support networks, seeking counseling for extra support when necessary. And I think one of the most important ones that I didn't put on here is finding purpose and meaning outside of your role. So let's talk specifically about stress management skills. So has anybody ever heard of diaphragmatic breathing in this room? Some people, great. So what we know about the diaphragm is it's the little V-shaped area right between the lungs. And so what diaphragmatic breathing does is it's the large, well, we talked about where it is, the large muscle located between the chest and the abdomen, and up to 60% of all of your lymph nodes are located just below the diaphragm. So here's some of the benefits of diaphragmatic breathing. It improves the venous return to the heart. So remember we talked about the body's stress response, and so what you'll see is diaphragmatic breathing can really combat many of those symptoms. It leads to improved stamina in both disease and athletic activity. Like blood, the flow of lymph, which is rich in immune cells, is also improved. And by expanding the lungs' air pockets and improving the flow of blood and lymph, abdominal breathing also helps prevent infection of the lungs and other tissues. And it's an excellent tool to stimulate the relaxation response that results in less tension and an overall sense of well-being. So if you guys would like to, I would love to have you practice a diaphragmatic breath for 1 minute. And what I'm going to do is I'm going to time you in this 1 minute, and I'm going to ask you to count how many breaths that you took. So I have another phone. I'll get here. Oops. Okay. So everybody put your hand over your belly, where your diaphragm is, a little up higher. Okay? And when I tell you to start, I want you to just count your breaths in 1 minute. Go ahead. Okay, stop. Did anybody have above 20? Okay. Anybody between 15 and 20? Okay. Anybody between 12 and 15? Okay. Anybody below 12? Awesome, awesome. Okay. So this is the slide that always surprises people. Breathing more than the medical norm at rest, that is only 12 breaths per minute, is called hyperventilation. So what happens to the body with hyperventilation is it reduces all of oxygen delivery to all the vital organs in the human body. So most of the time, people are not well versed on how to breathe properly. And so if I was sitting with you in my office, I would have my hands on your shoulder and I would help you to really start to put the relaxation response on and help you to really push the belly out when you do your diaphragmatic breathing. Because what I oftentimes see is that people tend to breathe from the chest. That's my phone, isn't it? Every time I bring that up. So what ends up happening is that people breathe from the chest and their lungs then don't fill with air, and therefore they have hyperventilation. So what I've devised is a way to help people to get half of those 12 breaths per minute. So I've devised what I call serial 3 breathing, and this helps people to get 6 breaths per minute. So if you're a yogan, you would probably breathe 6 breaths per minute at this point because you know how to breathe. But what's important about this, does this have a pointer on it? Okay. What's important about this way that we breathe, that I'm teaching you to breathe, is that, well, it doesn't. This spot right here is the key to breathing, okay? So what I end up doing with my patients is I teach them that you start with the inhale, and you would do a 3-second breath in, and then you hold your breath up here for 3 seconds, and then you're going to exhale for 3 seconds. And so therefore, you've got a 9-second breath, right? 3 times 3 is 9. And if you think about 9 times 6, you're at 54, which is less than 60 seconds. So you do 6 breaths in less than 60 seconds. Well, I guess it would be 7 if you're looking at the math correctly. But so what I'd like to do with you guys is do this as well. Would you guys be open to that? Okay. So let's start. So on my count, what I'd like for you to do is I'm going to count to 3, and then you're going to start your 3 breaths, or your 3-second breath in, okay? So 1, 2, 3, in, 1, 2, 3, hold, 1, 2, 3, out, 1, 2, 3. In, 1, 2, 3, hold, 1, 2, 3, out, 1, 2, 3. Okay, so what I'm going to do is send you guys home with this, but you get the picture. So what this does is it helps you to completely slow down your breath. And what I bet you'll find is that if you get really good at this, so if you're one of my patients, you have homework, and you go home with homework, and you practice this, during your meditation time 2 times per day. But what I find is that once my patients get very good at this, they start to add another hold right there. And so it turns into almost a square. So they're able to do another 3-second hold, and they're able to get their breaths down sometimes to 4 breaths per minute. It's very impressive when I watch my patients do this. So another skill that I teach is called mindfulness. Has anybody ever heard of mindfulness? I love Jon Kabat-Zinn. You've heard of it. I'm so happy to hear that. So Jon Kabat-Zinn is he is the king of mindfulness. And so what he teaches you is your mind full, as in that picture? So you've got stuff going around your brain all the time. Or are you being mindful, meaning the little girl is thinking about just the flowers and holding her mommy's hand. That's all she's focusing on, which is meaning that she's in the present moment, right? Whereas the mom or the dad, whoever it is in this picture, is thinking about all of the other things that he has to do. I remember experiencing this when I went with my family to Italy a couple of years ago. A couple of years ago, my mother is an immigrant from Italy, and she took us to her hometown. And while we were there, I had this experience with my relatives that I had never met before, that they weren't sitting there thinking about what's on their target list or what they're going to cook for dinner or what birthday present they have to buy for the girl next door for tomorrow. All they were doing is focusing on that moment. And it was such an aha moment for me, because I've been trying to teach this in my practice for 10 years now. And not until I had been with my Italian immigrants did I actually see mindfulness in action, where I saw them completely focused in the present moment, not wandering. Their minds weren't going to 10 different places about what they had to do. They were just there. And it was so beautiful. So what is mindfulness? Well, it means paying attention in a particular way, on purpose, in the present moment, and non-judgmentally. So if I am talking to a patient, I oftentimes talk about the importance of being in the moment, because if you're in the past, you're typically thinking about something that you're regretful about, you're remorseful about, maybe it leads to some sadness. If you're in the future, you're probably anxious about what may happen, what you might have to do, what my disease may look like 10 years from now. But when you're in the present moment, you're actually enjoying what this is, and that's the present moment. So mindfulness is not just looking, it's observing. It's not just swallowing, it's actually tasting. How many times do you get through a meal and you say to yourselves, I don't even know what that food tasted like. I just shoveled it down my throat, right? You don't just sleep, you dream. You don't just think, you feel. So you focus on those strong emotions. For me, I always give myself an intention for the day. So I like to live joyfully. And so for me, I like to say, today I'm going to live joyfully. And so I try to feel that emotion several times a day. I don't just exist, I live. That's what I like to say to my patients. And the last concept that I like to teach is called the mind-body connection. Okay? So how important is this mind-body connection? Well, let's do an experiment. Here I want you to, what I'm going to explain to you is the mind is so closely tied to what we feel in the body or what happens in the body. So let's do this experiment. Pretend that I went to Bed Bath & Beyond, or do you guys have Bed Bath & Beyond out here? Okay. And I bought a really nice cutting board and a really nice knife. It's a very sharp knife. And I brought in 4 lemons. Okay, I put them on my cutting board and I start to cut them up and juice is squirting everywhere. This lemon is so juicy. And what I'm going to do is I'm going to dole out pieces to each and every one of you, okay? So now you each have a piece of the lemon in your hand. And what I want you to do is put that lemon in your mouth and I want you to bite down. I see those reactions over there. Is the salivation starting? You're starting to get a physical response? Okay. Next, let's talk about styrofoam, okay? You know that styrofoam that if you order something in the mail from Pottery Barn, let's just say, and that styrofoam comes in the box. It's real thick, you know that styrofoam? It protects things. What I want you to do is I want you to take that piece of styrofoam and put it in your mouth and bite down on that styrofoam. Oh, it just makes my jaws hurt. I see many faces doing the same thing. Now this is my favorite one. So pretend that this is a chalkboard right here. And I have really long nails, okay? Oh, no. And what I'm going to do is I'm going to scratch my fingers down that chalkboard, right? What happens? Yeah, you're having these physiological experiences, but there's no stimuli. These are all in your mind, right? So I just described to you in real life, without using, you know, as my husband likes to call it, I'm using Jedi mind tricks. But I'm showing you guys in real life that there's no stimuli. This is in your mind, but it's creating a physiological response in the body. So, last couple of slides, I wanted to put up here one of my favorite quotes about pain. And you can look at pain in terms of emotional pain or physical pain. But the elimination of pain may not be an option, but the elimination of suffering clearly is. So what I hope to teach you guys is that you can control some of what's going on emotionally, even though you don't have control over your disease. So let's go back to Nina and just kind of tie things up here. So I've been seeing Nina now for over 3 years. And prior to stress management, Nina's MS continued to flare. She continued to come back with symptoms and flares, and the neurologists were constantly treating her in one way, shape, or form. But with the help of both stress management and psychotropic medication, her health and well-being has improved dramatically. Actually to the point where she no longer overuses her benzodiazepines in her wine. She doesn't complain of fatigue as much as she used to. She still has some fatigue. Her mood has drastically improved. And what's the most important, I think, is that her expectations are much are much less now. I think they're more reasonable, as I should say. And so I'm very proud of the work that Nina has done over the past 3 years. This is an old Bob Marley quote, but it says, "You never know how strong you are until being strong is the only choice that you have." And each and every one of you has been put in a role that nobody wants. Nobody wants this, but you have learned how to overcome this. You've learned how to be that lion. You've learned how to be strong because it's the only choice that you have. And so I wanted to give you just a couple of resources as we're ending here. One is from this book chapter that I was telling you about earlier that I wrote. And these are, I came up with 10 tips for caregivers to avoid burnout. And so you have those there in front of you. And then finally, I wanted you to have the Well Spouse Foundation. So this is another emotional support network, okay? And so at this point, I'm going to end, and I'm going to come to any questions. It looks like we have 10 minutes left. And I'm going to come to any questions that you may have. Yes?
Page 25, the circular breathing. How often do you do that exercise and how many times a day?
Sure. That's a great question. So the question was, for any of the satellite offices, is how many times do you do circular breathing per day and for how long? So what I do is I ask people to have what we call meditation time during the day. And so this helps to kind of recharge and kind of rejuvenate the body. And so I have patients to do this 2 times a day for 10 to 15 minutes, depending on what that they can tolerate. So circular breathing is definitely a part of that. And so I kind of give people a lot of different skills, and I let them choose what works best for them. But if you love circular breathing, then I think you should do it twice per day, 10 to 15 minutes at a time. Uh-huh. Yes?
What about sleep and interrupted sleep? Do you speak about that?
Yeah, we have a whole presentation on that. So what specifically are you interested in? I can try to answer that.
What is normal in the number of times that you should be getting up at night? You sleep 2 hours straight, 3 hours straight, and then get up and go to the bathroom?
Yeah, that's a very good question. So the question is, what is the normal amount of times that you should be getting up at night, and what do we call interrupted sleep? Well, my best friend happens to be a sleep psychologist, so I know a lot about sleep because I listen to her talk all the time. So she's going to come in handy right now. She's going to channel right through me. So what she would say is, as long as when you go to the bathroom, you go back to bed, that's a normal sleep pattern. So are you getting up and are you going to the bathroom and then able to fall right back asleep? Or is this something where you're then awake for 30 to an hour after that? Right, you're awake. So that's not normal, obviously. And so there are ways that we can help to manage that. So it depends on what the reason is you're getting up. So if you're going to the bathroom, there are ways to control that and manage that. If it's pain that's associated with it, there are ways to there are ways to manage that. So what you would do is you would work with either your neurologist or a sleep psychologist and try to figure out how to get yourself back on a regular sleep-wake cycle. So oftentimes we have to look at how much energy you're expending during the day, and does your body need stress, or what time you're going to sleep. So it's such a multifaceted question, so we need to look at kind of a whole history. As the body ages, you need less sleep. So a lot of times people hear this, that you need these 8 hours of sleep, but as the body ages, some people can get away with 6 hours of sleep. So if you're going to bed at, let's say, 10 p.m., then you're up by 2 a.m., you're getting a lot of sleep for yourself. So I think it would just be important for us to look at that specifically, and each person's sleep-wake cycle is going to be very different. Yes?
What about naps?
Yeah. So I am an advocate of my patients taking naps if they have fatigue. I will say that if you take a nap, it needs to be less than 30 minutes. Because you go into REM sleep. So once you start disrupting your REM sleep cycle, you're going to actually be more tired as you wake up. So what I work with my patients, I do what's called a fatigue management protocol with them. And we look at when the person is the most tired during the day, and then we help them to plan naps, and we actually help them to plan exercise in there too. Because believe it or not, exercise helps with fatigue management. So I think it's important, yes, to nap, but I think there's a rule that we should be aware of, and that is don't sleep more than 30 minutes. And so you have to set your alarm for that, because if not, you're going to feel groggy and more tired. In addition, that's going to disrupt, if you sleep more than 30 minutes, that's going to disrupt your sleep cycle at nighttime. Other questions? Yeah.
It's a comment. I don't know if you know who Milton Erickson was.
Of course.
He taught a technique for falling asleep. You suspend your tongue. Don't let it touch sides, any part of your mouth. Just lay there with your tongue suspended, and within minutes
you'd fall asleep. Oh, that's interesting. I'll have to remember that. I've never heard him say that, but that's interesting. Thank you. Any other questions that I can answer? Yes.
Exercise.
Yeah. Tell me, what's the question about exercise?
Well, I think that really the only safe exercise when you get older is just walking.
Or pool activity.
Pool.
Yeah.
Okay. What about weights?
Well, yeah, I think weights are important because it helps to prevent against osteoporosis. So we need your bones to be very strong. I think anytime you involve, well, the question is about what are safe exercises when you get older. So walking, pool therapy, yoga is very important for people as they age, because that's you hurt your back. There are many different types of yoga. So there's one particular called restorative yoga that I think is very important. I actually have one of my MS patients teaches this form of yoga. It's a very gentle yoga. And so there are actually, there's a website that the MS Society publishes, and you can get a free MS DVD. And even if you don't have MS, it's still a very gentle form of yoga. So yoga is important because it strengthens the muscles, but I think exercise is very important for not only for overall general health, but for stress management. In fact, I wrote an entire dissertation on that, and for mood. I'd like to share with you just real quickly a study that I did when I was doing my fellowship at the Cleveland Clinic in the pain medicine department. And so I had people to get on a treadmill and to walk for 10 minutes at a time, okay? And the people walked at a speed of a bride walking down the aisle. So they were not racing, right? They were walking pretty slow, if you would say. What we found in this, and this got a lot of attention because the exercise protocol was only 10 minutes in time, what we found is that people had a significant decrease in anxiety and depression, and their mood improved, okay? So I really believe strongly in the effects of exercise in the mood as well as the physical activity. Yes?
Is it the same whether you walk, like everybody says, walk 30 minutes a day? If you walk 10 minutes.
That's what I recommend. Yes, very, very good point. So the question was, can you break up your 30-minute cycle? So why that's so important is because if you break up your 30-minute cycle into 3 10-minute cycles, then the anti-anxiety and antidepressant effects will continue throughout the day. Because what generally happens is that those effects start to go kind of a little bit south as the person is 1 to 2 hours out of the exercise. But if you're doing 10 minutes in the morning and 10 minutes in the mid-afternoon and 10 minutes in the evening, you find that the mood effects and the stress effects are certainly there.
Good. I like that.
Good.
Sir, did you have a question you wanted to ask Dr. Sullivan?
No, I decided not to.
Oh,
Thank you.
Sure.
Thank you very much,
Sure.
Dr. Sullivan.
Sure.
We really